And as of yesterday, 1,657 patients were hospitalized due to COVID-19. And as another way of thinking about that fact, the 3-day average of the number of patients that are hospitalized for COVID-19 has dropped by 50% over the past 30 days. These positive trends in the public health data are the primary indicators of how COVID-19 is impacting our communities, and it will continue to determine how and when we pursue measures associated with our reopening program. We've also made significant progress in fighting COVID, and more people are opening businesses. But as more things reopen, and as we get into the summer, we must all remember how quickly we move forward will ultimately depend on how well we all do our jobs. Cover your face, wash your hands and surfaces, distance yourself from others, and be vigilant with respect to symptoms. And please stay home when you can, and especially if you don't feel well. As we move ahead to start our reopening program, we must continue to ramp up the viral testing we've been doing for COVID-19. On Saturday, the Command Center filed a plan with the federal government to expand COVID-19 testing and has received $374 million in federal funding to do so. Our goal is to expand testing for symptomatic individuals and their close contacts, and to upgrade our state's epidemiological technology infrastructure. Massachusetts, as we all know, is one of the states that's been hardest hit by COVID-19, and has had the third highest number of positive COVID-19 cases per capita in the country. It's important that we stay on top of testing to expand access and to monitor for outbreaks. Now, since we began testing, we've been able to test about 4.4% of our population each month. We'd like to see that percentage expand as we build additional capacity. And by the end of June, we're looking to expand lab capacity to be able to test 45,000 tests per day. DPH is also taking steps to expand their lab testing capacity at the state lab. Currently, the state lab can process about 1,000 tests per day. The department will install 2 platforms, one to increase diagnostic tests by 1,300 molecular tests per day, and one to conduct up to 1,600 serology tests per day. To better identify communities that have limited access to testing, the Department of Public Health will create a strategic testing program expansion, or so-called STEP program, to identify important sites that need to have additional attention. The goal is to open 20 of these sites by the end of July for areas with a high number of COVID-19 cases where there isn't sufficient testing capacity, or so-called testing deserts. All of this expanded testing capability is essential to our contact tracing program, because this is how we bring the fight to the virus and expand the hard-fought gains we've already made. We appreciate the federal government's support and the $374 million that they've allocated to Massachusetts to get this underway. But to build a comprehensive testing and tracing program that sustains our Commonwealth for the next several months, we'll need additional resources. And our administration urges Washington to continue to work with states and make more funding available for testing and tracing so that we can fight this virus with every tool and resource and prevent it from spreading into our communities in the months ahead. On the reopening, I signed an executive order on Monday that allows businesses to prepare to reopen in Phase 2. As a reminder, our public health experts will be monitoring health data all week to determine when we can start Phase 2, and we plan to be here with you on Saturday to detail the results and when Phase 2 would start. We know that businesses are eager to prepare for reopening, and families are looking for guidance on services like childcare and summer camps. I think the information we have today will help many parents begin to plan for the summer, and will help businesses take the right steps to fight COVID in their facilities as they reopen.